So I'm just gonna start in the just coming off of the heart here for the arteries. Remember, the arteries are supplying, so this is gonna be going out. So as we exit from the left ventricle, the blood is gonna move into the aortic arch. Right? From the aortic arch here on the cat, you see two major branches. You have the brachiocephalic branch and the left subclavian artery. Right? In humans, please keep in mind that there is a third branch here, the left common carotid. Right? So on the cat, if we continue to follow the brachiocephalic trunk, you'll see that there are three branches here coming off of that brachiocephalic trunk behind the vein here. And going from left to right, you're going to have your left common carotid. In the middle here, you would have the right common carotid. And then finally, the third and final branch here, all the way to the right side, is your right subclavian artery. Right? Now, if we follow that right subclavian out beyond the rib cage, it becomes the right axillary, which is not visible here, and then the right brachial as it moves into the brachium. Right? So just be aware of that. As we follow the left subclavian out, you see the left subclavian going beyond the rib cage here, becoming the axillary, right? And then eventually supplies the brachial artery, moving through the brachium. So those were the major arteries in the cat that we're going to focus on. As we make our way back, now we're draining these regions. You have your brachial vein. And again, that brachial vein, as it moves out of the brachial region into the axillary region, becomes the axillary vein. As it comes back into the rib cage, the subclavian vein, very brief segment here. Then that drains into the brachiocephalic vein. And notice the Y-shaped structure here. Right, those are the two brachiocephalic veins. They merge together to form the superior vena cava. Right? And then that superior vena cava, of course, drains into the right atrium. One last vessel we want to consider here as far as draining into the superior vena cava, you have your azygous vein right there. So the azygous is going to drain these intercostals, and then the azygous drains into that superior vena cava as it's draining into the right atrium. Right? And then, of course, on the left side here, you see where that aortic arch becomes the thoracic aorta. Right? The aorta then continues to descend beyond the diaphragm into the abdominal cavity. So here now you see the abdominal aorta. Right? The first two main branches that we want to consider here off of the abdominal aorta, the celiac trunk and the superior mesenteric. Right? Remember, the celiac trunk is going to give rise to the hepatic artery supplying the liver, left gastric that supplies part of the stomach, and the splenic that supplies the spleen. Right? From there you have your superior mesenteric, which is going to supply the mesenteric arteries that are moving to the small intestine and that supply the ascending and transverse colons. Right? Not visible there. Continuing on down, the next major branch that we want to consider is the renal artery that is supplying the kidneys. Right? After that, you have your gonadal artery, in this case, spermatic or testicular artery, just making its way down to the testes. Remember, in a female cat, the ovaries would be here, just caudal to the kidneys, so that ovarian artery would then just move lateral. Right? And so be aware of that. As you continue to move down, the next major branch is the inferior mesenteric, which is that guy there, which is supplying the descending colon and then the sigmoid colon. Right? And as we get deeper here, it's harder to see now, but that abdominal aorta would then branch into, and the cat's external iliacs, which then supply the femoral arteries. Right? And then you would have small branches of the internal iliacs, even deeper to that. Right? And then once you make your way out of the abdominal cavity, you have your femoral artery. And on the cat, that's where we would stop. Right? If we're draining back, you would have the great saphenous vein, very superficial on the medial aspect of the knee, draining into the femoral vein. That femoral vein makes its way back through the abdominal wall. And again, not very visible here, but the route would be the femoral vein drains into the external iliac vein. That external iliac vein would merge with an internal iliac vein to form the common iliac vein. Then you have a left and a right common iliac vein that merge together and ultimately drain back into this inferior vena cava. Right? As we make our way up the inferior vena cava, on the left side, we only have one main branch here, and that's going to be the renal vein draining back into the inferior vena cava. Keep in mind that on the left side, the gonadal vein would drain right into that left renal, right? Whereas on the right, you would have a gonadal vein draining into the inferior vena cava. Right? So on the left side, make sure you're aware of that and you see that the vein is barely visible right there, right? And it looks more red than blue, right? But you can see that it's clearly going into that renal vein. Right? And on your way back up, those really are the only main branches, right? And that's it.